Okay, hope it works. Okay, well, I think we're live now. Okay, hi, I'm Malik, licensed acupuncturist, herbalist, and nutritionist. I'm joined today with my colleague and good friend from Portland, US, Dr. Thompson Magbanua from Acupuncture Gateway. He's one of the top experts, and he's developed a system, an acupuncture system called Body Mapping. He's treated well over 60,000 patients. Welcome, Dr. Cole, and please introduce yourself.
Oh, thank you, Malik, very much. And yeah, I appreciate the opportunity to talk with you today and share any kind of information I might be able to that might assist some of your viewers or yourself, in some of the practice and techniques of acupuncture that I find effective in my private practice. We've been teaching this for, 15 years now at least. And we've got a small book and a chart here that I'll show you in a minute. And yeah, if there's anything I can share that'll help, shoot away.
Sure, excellent. Well, firstly, I must say I've got your book as well.
Oh, wonderful! Thank you.
So it's a fantastic book, and it's really, comprehensive, and it's obviously going to be useful for an acupuncturist, especially if they want to get into, I'd say, the balance system or master tongue. So you made it very easy, and yeah, so great stuff. So you've got extensive experience, well over how many years?
I finished acupuncture college, the first round of it in '97. So we're getting up to 25 years or more. And I started actually natural medicine in Nepal, interestingly, and I did massage therapy before that, but homeopathy even before that. So that was '93, I guess. So we're coming up on 30 years here in a few years. So at least 25 or so. And I studied with Ayurvedic doctors, Tibetan doctors, before I went on to acupuncture college. And then that was a 3-year program at the time at the Oregon College of Oriental Medicine. And, they just teach your basic TCM techniques. So basically the school just teaches your standard stuff out of Chinese acupuncture moxibustion, which is that text is translated from Chinese. And so we learned, your basic points, your basic imaging stuff. And there wasn't a whole lot of, there was like, oh yeah, here's PC6 for digestive issues, and it's empirical. And oh, here's stomach 40 or stomach 38 for treating shoulder pain, and it's empirical. So we'd ask, why does that work? And they'd be like, it's empirical. Literally, we don't know. Like, we don't know why it works, but it works. And so I still say that a lot. We don't know. But I have a theory we have theories now and imaging systems as to why that stomach 38 works for shoulder pain and why that PC6 works for nausea and chest and opening up these areas. And it's a matter of balancing the channels, pairing up the channels, and also following an imaging system, like a microcosm, if you will, a microsystem. So similar with the way we have the whole body mapped on the ear, or we've got the pulses, upper jiao, middle jiao, lower jiao, or we've got the tongue, which shows upper body, middle body, lower body. So these micro images or systems are everywhere. And this is just one version of using an acupuncture version of that. And on the arm or the leg, typically, to treat the whole body, or the opposite arm or leg. And most points are found on the opposite side. And we use these imaging and these channel relationships. Usually the Chinese name pair is used quite a bit, or the clock opposite pair, meaning Chinese clock and the opposite time of day. So midnight's gallbladder, 11 to 1 in the morning, and then 11 in the morning till 1 in the afternoon is heart. And so heart and gallbladder pair because they're opposites on the time of the day. We don't really care quite so much exactly what time they are. We just care that they're opposite each other, because that creates this energetic balancing effect where you can use one channel to treat the other channel. So if there's a gallbladder channel headache, for example, you might find a heart channel point along with that image to find exactly where on the head. And then you line up that kind of crosshair and you find the point, you palpate for tenderness, you stick your needle in, and then there should be an instantaneous relief. We don't always get that instantaneous relief, but that's kind of the goal. The going for is, I put my needle in, I want that to have a reaction right now. So we know proves to me that the point was effective and I chose the right channel, right image. Also proves to the patient acupuncture is effective and works instantly. And everybody is wowed. 25 years of doing this system, I'm still wowed every treatment. And so it's a very happy and fun thing to do. And it's like you're doing magic every day. You know, I couldn't think of anything better to do with my time. Do a little magic.
Absolutely. And you travel and you teach a lot as well, don't you? Teacher.
Yeah, so predominantly I've taught for a number of different organizations and various acupuncture groups. The predominant one I'm working with right now is E-Lotus, which is with also Evergreen Herbs. And Tina Chen, John Chen, and that Evergreen and E-Lotus staff are fantastic to work with, and they're wonderful people. And they've got a great product at Evergreen Herbs. Granules, there are wonderful, and pill forms, of course. But they also have all these online lecturers, lots of Tung acupuncture if you're interested in Tung stuff, and then a lot of Richard Tan. They've got his old seminars on there, and then they've got people like me. Since Richard Tan, rest in peace, is passed on, some of us have kind of picked up, you know, his systems and have our own little slant and version of it. So my version is I've simplified some of the systems, right? There's like 6 main channel relationships that he promoted and taught. And I have narrowed it down to basically 2 and a third one. And then the imaging is almost identical, the same. And then I just kind of keep to that, you know, that 1, 2, 3 kind of thing, which is, he's got a book 1, 2, 3. So Richard Tan's a great reference. If somebody's interested in what I'm doing, that's kind of my starting place. I originally saw him in '95 and studied with him when he came to OCOM to teach. As soon as I saw him do the dog and pony show, he used to call it, which is treats the whole room full of people in about 30 minutes. So it's like a minute a patient, which at first I thought not possible, you know, pulse, tongue, whatever. He's like, forget it. Where does it hurt? If you can point to it, I can treat it. And so he would just, you know, where does it hurt? It hurts here. Boom, boom, boom. He throws 3. How's it now? Oh, better. Move on. Next patient. I mean, like, we're just like hard to follow how quickly he was moving through people. But what we found in treating in public health, which is where I got a lot of my experience, lots of patients, really fast paced, 30 patients an hour kind of thing. And you can do it. I mean, once you get these systems in your head and memorized, and the images in your head and memorized, you just roll through the systems, roll through the images, and you know, you can treat a patient in a couple of minutes. It doesn't take, you know, 30-minute intakes. I mean, 2 minutes and I'm on to the next patient. Typically, when I know the case and I know the patient, it's very fast. Yeah.
Excellent. Yeah, I think you're fortunate to have met some great geniuses like Dr. Tan.
Yeah.
And I certainly I think, you know, looked at your stuff and I found that like a stepping stone into the imaging systems, and it's really been helpful, I must say. And
excellent. Now, all of these imaging systems are useful and important, right? And some people will ask me. I'm just going to show you some images here on the back of a chart that we've developed. But here's an imaging system, and so you've got extremity images where arms and legs relate. You've got a torso image where the whole body is related to an arm or a leg. Torso meaning head to tailbone, right? Torso part. The arm relates directly to a leg, almost like we're a 4-legged, you know, kind of creature. Fingers and toes relate, hands and feet, wrist and ankle, elbow, knee, hip, shoulder. You know, very similar joints, right? The elbow's a hinge, the shoulder's a ball and socket, the hip's a ball and socket, right? So we have very similar looking. And I've sort of, my version and my little addition to this is that I've added the piece of anatomical correspondences. So that's sort of what the book you showed earlier is about, is anatomical correspondence using these images and systems. So basically what we're talking about is, how does the shoulder relate to the hip? Like, where exactly, it's not just like shoulder hip relate, but where on the shoulder relates to where on the hip. And after I sort of played with the skeletons for a while and looked at those bones and the bony prominences and where on the bone relates exactly, then you can look at the muscles and the actions of the muscles and the origins and insertions. And it really pays a lot of benefit to really study the anatomy, because acupuncture is a very physical medicine. And so knowing the anatomy and knowing where those origins and insertions of the muscles, where the nerves innervate, where the muscle bellies are, and then finding that opposite side muscle belly, muscle origin and insertion, really give you excellent results in finding the exact point, not just where on the, not just the shoulder, but finding like the teres minor muscle to treat piriformis, right? So that's the back of the hip, the back of the shoulder. Both muscles do external rotation. They do a little bit of extension. So very similar things that are useful to take advantage of, in addition to, you know, the general idea that shoulder and hip relate, and the channel, small intestine in the back of the arm, taiyang, right? That's arm taiyang, hand taiyang, leg taiyang, bladder channel in the back of the hip. So those taiyang channels, name pair, treat each other, but where exactly? Oh, well, taiyang in the arm, it's a big area. Small intestine's huge back there. Bladder channel is even bigger on the back of the hip. So where exactly? Oh, the piriformis and the, you know, teres relate because they have these actions that mirror each other. And the origin treats the origin. The belly treats the belly. The insertion treats the insertion. So you can get very focused if you can palpate. So palpating becomes very important. And then palpating, where is the pain? Oh, it's not just anywhere on the piriformis, it's the origin way over at the sacrum, or, oh, it's the insertion of it out at the trochanter where it attaches to the bone and creates that movement on the hip joint, on the trochanter. The femur does that external rotation because of the attachment at the back of the trochanter. So that means I need to look at the back of what? The humerus at the attachment of the teres muscle, which is right back there. So then you're palpating carefully to find it. Then you're palpating carefully to find your corresponding point. And then you might need a longer needle to penetrate through all the tissue to get to right where it attaches at the bone. And so you might need a skeleton and a good anatomy book to like find out exactly where does that attach exactly. Is it on the inside? Is it on the outside? Is there a nerve right there I have to worry about and not hit an artery maybe? And so knowing these kinds of pieces of anatomy become very useful as you advance in this style of distal acupuncture.
Amazing. Yeah, amazing. I could listen to you for hours. Amazing. Yeah, just brilliant. So what conditions do you get a lot of in your clinic?
Well, I think most Chinese medicine, I think the number one, at least in the United States, which is where I practice, of course, I'm in Oregon, Portland, Oregon, which is famous these days with all our crazy riots and the overreach of our federal troops in the COVID era and the Black Lives Matter movement. But we're on the map now. Everybody knows where Portland, Oregon is, right? So we're infamous or famous. Not sure which one it is, but all safe in my neighborhood. It's just the downtown that's a bit chaotic. And, crazy. You'd think the whole city's on fire, but that's not really the case. But in the United States, anyway, most, I think 80% of patients going into an acupuncturist are for pain. And so when you have a technique that gets instant results on pain, you're going to be a successful acupuncturist. I don't care which version of technique, family lineage, whatever you want to do. If you are having effective pain treatment that's getting better than 50%, now 50% is placebo level, right? If you stick a needle anywhere, you get half your patients better. If they walk in your door, half of them get better. It doesn't matter what you do. So if you're getting 50% results, you're in placebo territory. And there's a huge placebo effect of acupuncture, massive. Stick them anywhere. Now, they're trying to figure out why that works. They don't know. I mean, there's pain receptors, there's endorphins releasing as soon as you stick a needle in somebody. So you get some automatic sort of down regulating of pain response in the brain just by sticking a needle anywhere in somebody. But if your results are 50%, then that's the result you're getting is that brain chemistry response is my understanding. Now, I could be wrong on this, of course, but this is how I understand how this works. If you're getting more like the 60, 70, 80%, 90%, now we're talking, you are getting very specific results to a specific location of pain. Now, especially when you get an instantaneous effect, and if you miss it, you don't get the instantaneous effect, or you get part of it, but you don't get all of it, or you get one area of pain, but the other area still hurts. Now we know that our point that we're using treats this spot, treats that spot. There's a correlation between these two dots on someone's body, and they're three-dimensional dots. They may be, depths. You can get them from different angles, but just because I put a needle in your shoulder, it doesn't mean your entire hip is better. It just means that spot on the hip is better, right? If the whole piriformis muscles, to take that example again, if it's the origin, the belly, and the insertion of it, and you just put a needle in teres anywhere, you may get the belly of it, but you miss the origin and the insertion until you get those two spots more specific. They're still there. You go back and palpate. Oh, that still hurts. That part's better. Oh, the other one still hurts. So then it helps you figure out, okay, where exactly do these things go? And that's where the experience and the continuous palpation as your treating goes. So in the beginning, this takes time and it takes a lot of palpation. As you get better, you just know, oh, it's in this, it's in this. I know I can go here and here and here, and that's going to get it. Bing, bing, bing. I hit him. I go back and check. Done, gone, or whatever, right? So very useful, again, that palpation piece. And so mostly pain treatment for my patients. Back pain is probably number one that walks in the door. I'd say between neck pain and headaches, which usually are tied together, is number two. And then it's going to be something like foot, knee, hip, shoulder. All of those come in next as far as pain things. And then you get your random rib pain, elbow, finger joints, arthritis kinds of situations. Mostly those kinds of things. So even though just recently I taught a class on internal organ disease, heart disease, immune, rheumatology, that kind of thing, 90% of what walks in my door is pain. And so you want to be really, really good at that. And it's nice to have our herb pharmacy. It's nice to have our pill formulas. It's nice to be able to, even have bulk pharmacy, if you have enough patients to your herbs don't just go bad on you and you have to constantly replace them because they get infested with bugs. They come with bugs on. I've gone to a granule pharmacy and pill pharmacy because I just can't use enough of my bulk herbs. My patients aren't interested to go home and cook a nasty smelling tea and drink it. The granules work fine for most of my patients. I've got MS patients. I've got, Crohn's disease patients. I've got GI patients. I've got all kinds. About 10% of my patients I give herbs to. I mean, it's a very small amount, and that's the amount that are coming to me for an internal organ problem. And I give them a whole sort of lifestyle and herbal approach, right? I'm looking at diet. I'm looking at lifestyle, behavior. What are they eating? Do they need probiotics? That's huge. If it's an autoimmune case, absolutely need probiotics. And then I give them herbs. And my goal is for them to be off the herbs someday. I want them to be healed and not need my treatment. I don't always get that. I got a Crohn's patient. She's been on my herbs for 3 years, but she is symptom-free if she follows a diet and she takes the probiotics and she's on my herbs, no symptoms, which is amazing to her. Like, she was miserable for 30 years of her life, and now she's symptom-free. But if she gets a lot of stress and she doesn't take the herbs, or she goes off the diet, symptoms start coming back. She has to go back on stuff. In the perfect world, she doesn't have stress and she can taper off the herbs. And we've gotten to those situations. And my goal is her to be off the herbs, keep on the diet, because that's the healthiest diet we know of. And longest lived people that live the healthiest eat plant-based. And so that's the thing we know. Other than if someone has specific allergies, we have to worry about those. But mostly people are coming in for pain. So having this kind of a technique is very useful and very effective, at least for me, when I do it in my practice.
Excellent. And you tend to get what, 70, 80% results at what you do?
I think that I get about maybe 75% immediate changes.
Okay.
So about 75% of the time, I put a needle in somebody and I get an instant result.
Yeah.
It's not always 100% relief, but I'm going for at least 50% relief.
Yeah,
immediately, instantly, or within a couple of minutes, 50% relief. If I don't get that, I would start asking what's wrong. Why didn't it work? Did I misdiagnose it? Did I miss the palpation?
Yeah. Did
I miss my point? Is the point not stimulated enough? Does the patient just not respond to acupuncture? There are a few handful, 5%, I think, that just don't respond to no matter what we do. I think that's any practitioner you ask will kind of agree. I've yet to come across one that says 100% results. Usually there's a 5% or so that just don't respond no matter what I do. And that's that. And then those patients, if they are willing to keep coming, I throw the book at it. I start digging through the books and looking for things that I can't figure out. I try local, I try electro, I try moxa, I try everything, throw the kitchen sink at it. Still no results. So in those patients now, 99.9% of the time, I do distal acupuncture. I do what I'm talking about. What I teach is what I do. And the reason why I teach it is because that's what I do and that's what works for me. I would never assume to teach something that I didn't know about or that I didn't see results with, right? So if I didn't see a result and wasn't sure that it had effect, I wouldn't bother talking about it. I would say, I don't know. I've heard it works. I've tried this. It's worked on a couple of patients, but I just don't know if that's going to work out for thousands of patients, right? But we all treat a lot of pain. So we see thousands of headaches over 20, 25 years of practice. You see thousands and thousands of headaches. You see tens of thousands of back pain patients. So you know what's going to work and what's not going to work.
Absolutely. many years ago when I was in the clinic, standard treatment is the local, traditional.
Right.
And when I picked up on the imaging and tan stuff and whatnot, so I applied some of that, and we had immediate results.
Yes.
And when you tell your professors, they're kind of like,
Yeah.
they laugh it off. They think, oh no, it's a gimmick. But
Yeah.
it happened once, twice, thrice,
Yeah.
over and over again.
Yeah.
And
you're right. And some practitioners will say, oh, but it doesn't last. It'll last a few hours, a couple of days, but it comes back. Well, all of it comes back. I mean, you have most patients do not get a single fix. I don't care what kind of style you're doing.
Yeah.
There are the cases we have. I had a patient with a 20-year chronic migraines, daily migraines for 20 years, one treatment gone. I saw her a year later. She came in once. I didn't see her again. I thought, well, must not have worked or something. She comes in for a completely different condition, her knee or something hiking. She comes in and I look at her chart and I like, oh, you used to have migraines. I treated you, wow, a year ago. How are those? She's like, oh, I haven't had any since. What? You haven't had any since? I'm like, what did I do? What did I do? The magic treatment. Oh, it's the same thing I do on everybody. It just works like that for some people. I figure that instantaneous one treatment fix is about the same percentage of patients I can't help at all.
Yeah.
It's like that 5% range. There's this tiny percent I can't do anything for, and there's this tiny percent that get that one treatment, it's gone forever. Yeah. I wish I knew how that worked. Richard Todd used to say that. He used to say, if I could reproduce that, if I could package that and stick it in a bottle, I could charge $1,000 a treatment, he used to say. He was kind of after the money side of it. Yeah. But everybody else is in the bell curve somewhere. There's a result that lasts a period of time, and then the stagnation sets in again, and then you have to treat it again. So the ideal situation is you treat a patient, you get a certain amount of relief instantly. That relief lasts a certain amount of time. The perfect world is if we could be in touch with that patient every day, and as soon as the pain starts to come back, we hit it again, right? Yeah. We don't want it to go all the way back. If the pain was a 9 out of 10 and we treat it, it goes down to a 3, and then it's the next day it's about a 4, and the next day it's a 6, and by the third day it's back to a 9. I want to treat it on day 2, right? And then usually we're kind of a step ahead of it. And now, since we've already created that flow one time, the second time it's a little easier, and we can get a little more focused. Usually it changes a bit, like it shrinks. Usually you get pain come in, it's everywhere. And then as you treat it, it narrows and narrows and focuses usually to the original injury. So typically these diseases, they reverse in progression, right? So usually they've had it a long time. It's progressed at a certain rate. Oh, it started as a hip injury 10 years ago with a car accident, and now it's in my back, and then it moved over to my hip, and now it's up in my shoulder. And, as you treat it, it unwinds, and the newest symptoms go away first, and eventually you get to the original injury. That may take a little longer because it's been there so long. And so I kind of give my patients the rule of thumb that we learned in school was, for every year of disease, month of treatment, right? And for me, what I say is that's to a curative state. Now, you may be very happy at a 1 out of 10 pain halfway into that, right? We may get to a 1 out of 10 in 3 months, and it may take literally another 3 months to get it to 0, because that last stagnation just takes a long time for the body to finally heal to the deepest level. And I do find that to be the case with my patients.
Excellent. Okay, so if someone rings you, okay, what would they expect in their first treatment?
So yeah, I just had a new patient in yesterday, low back pain, and he was really bad, a construction worker, and I've been lifting things too heavy. And someone from his construction crew said, hey, you got to go try this guy. Cool. Okay. All right. So he calls up, same day. We just happen to be, we're a little slow with COVID. We don't have as many patients coming in. So I can slide him right in. So, and it was the end of the day. Everybody else was gone. He was kind of a single guy by himself. I put him back, curtained it, so it's all protected and safe. We're all masked and gloved up, and stuff like that. We spray everything down. So we're as careful as we can be, and be open. We don't want to have a problem and have an outbreak in my clinic or something, and then they shut all the acupuncturists down because, there's one guy who had don't go to acupuncture, and then we're infamous for that, right? We don't want that. So everybody, please be very careful with your patients if you're watching this in the COVID era. Otherwise, he calls in and says, how much does it cost, and how long does it take? And I figure about an hour. A low back pain, kind of a simple case, in and out in an hour, basically. So I want him to sit with about 40 minutes, 45 minutes. I actually did cupping on him as well. I was telling him about cupping. He had heard me cupping the patient before him and was curious about it. So I explained it to him and said it's really good for long-term back pain. And he said, yeah, he's had this thing recur over and over again over the years. He's been doing construction for like 30 years. So I was like, cupping's probably a really great thing for you. It's a little bit of a shotgun approach, right? We're not going to know what did the long-term benefit. Was the cupping that did it, or was it my acupuncture that did it? Though, that being said, I explained a little bit to him, a new patient, okay, so these are needles. They're needles. They go into your skin. They're going to hurt a little bit, but they're not going to hurt a lot. I use a very thin 38 gauge, very thin needle, 1.5 inches long is my classic needle size. And I usually put more needles in than most people would expect for doing a distal style. But using such a thin needle, I think that it doesn't hurt as much when it goes in, first thing. It doesn't damage as much tissue, second thing. But third thing is, it doesn't cause as much of a reaction with the tissue because it's so small, right? The bigger and thicker needle and the stronger stimulation you do, you get a bigger area of influence in the spot that you stick it in. If you do less stimulation, less influence, less pain to the patient, it also stimulates a less of an area. You have to be a little more accurate if you're using a thinner needle, or just use a whole bunch more needles. And if you're treating a big muscle area, like the whole lumbar was in pain and the spine, right? So we did points on the CV channel below his navel. That treats directly front to back to treat the GV. Instantaneous pain relief. I put 3 needles in, but like CV 7, 6, and 5, I just went bing, 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 and put them to a depth of about 1 inch. What I do is I wind my needles. I turn them in one direction, like you're winding something, until it grabs the tissue. And then unless there's a lot of pain. If there's a lot of pain, I don't do that. But if there's no pain, he said, I don't even feel it. So then I just turn it until it grips. And then I figure like that's as much chi as I need. If that didn't work, something's wrong. I missed it, or it's broken. There's some real big damage, something like that. But usually that's plenty of chi stimulation. Go back, palpate the spine. Pain's gone in the spine. The muscles are still really tight. Okay, so I go down to bladder channel, bladder 58, 57. I put about 3 needles in the calf muscle on each side. Go back and palpate. That's relieved. It came out to the quadratus lumborum. There was a tender spot, palpating from the side a little bit, almost like where the oblique meets the quadratus there on the side. Belt channel is where I find that. So that to me is gallbladder 41. Same side, same channel, same side. Go down, needle gallbladder 41. Kind of a special way to needle it for me. I needle it under the tendon and towards the bottom of the foot. So the angle of the needle is like this. If this was your foot, the angle is this way, going down under the foot, almost like under gallbladder 42. So it's like starting from 41 and then needling it to the base of the foot at where it would be beneath 42. So it's kind of a long angled needle. To me, that's the direction you have to get to hit belt channel specifically. If you just put it perpendicular, it doesn't really work for me. So I always get that angle right, and then it releases. Now that released for him, and pretty much his pain was gone. He did have some pain in the hip as well, the gluteus maximus, minimus, medius, a little bit of wrapping around the side. So then that's all deltoid and some teres, some infraspinatus. So I needled 4 or 5 needles across here, both shoulders to treat both hips. It was about 20 needles total, and that took away all of it. There was really laying there. He walked in with a 4 out of 10 laying on the table. It was a 0 by the time I finished putting the needles in. And then when he got up and moved around to lay on his front, he's like, there's still a little bit right on the spine. So what I figured happened was he lifted something really heavy in his work, which is what he said he did, and he strained the ligament that goes up and down the spine. It's called the nuchal ligament. It runs up and down those spinous processes, attaching and holding all the spine together. And I think he just, in a bent over position, lifting something very heavy, just strained those ligaments. And so he's got pain on the spine, but it doesn't mean it's a spinal or a disc problem necessarily. It could be a disc problem. We just don't know, no x-ray vision, But if we treat it and the pain goes away and the little bit of nerve symptom he's having into his butt goes away, it's probably not disc. Plus he was having it bilaterally. Very rarely will you see a bulging disc hit both nerves. It usually bulges to one side or the other, or to the back or to the front. It doesn't go both sides. I mean, that would be like a totally ruptured disc that's spilled out juices everywhere and gets both nerves irritated. But he didn't have that much pain for that. I mean, and the pain wouldn't go away instantly with acupuncture if there was that much injury, like a ruptured disc. So I figure it's just muscle spasm and strained ligament. And so the muscles relaxed. Then we put the cups on. He just floated right out of my clinic feeling like $1 million. He's like, and he was a total skeptic. I don't believe this, whatever. I'm just trying it out because I hurt so bad and I'm tired of taking pills, whatever. So that's a classic first patient. And I'm constantly checking in. As a new patient, I check a lot. Is that needle okay? Is that needle okay? How does this feel? Is this okay? Is that too much? Oh, I felt that one. Okay, let's give that about 30 seconds to tone down. And if the sensation goes away, we're good. If it's irritating still, or you're getting electric shocks from it, we'll immediately adjust it, which means I usually back it out about halfway. And usually that takes the pressure off the nerve it's next to, and then that symptom goes away. If we got real close to the nerve, then sometimes you'll continue to get that residual nerve symptom for a few minutes, and then usually it tones down and goes away. But with the thin needles I use, I haven't damaged a nerve in, oh man, 25 years I've been doing it. I have seen damaged nerves though from other acupuncturists. Thicker needles, heavier stimulation, heavy duty, right over a nerve, and you can really, damage them. And then you've got months of burning pain from that nerve damage. So careful with those. But most of the time we're pretty safe.
Excellent. Excellent. So if someone wants to contact you for an appointment, how do they, what they go to your website? What's your website or telephone number?
Yeah, most people find me on Facebook, or they search for Google search for acupuncture in their neighborhood, and we just pop up. Most of my people are in the neighborhood, or it's a word of mouth. Those are the two main ways we get patients. I am on a number of insurance panels, so if people go to their insurance panel, they'll see me looking for somebody in their neighborhood. Again, that's, I might show up in the insurance panel in the neighborhood. But if somebody from, a student, say, another acupuncturist was interested in studying these techniques or learning, they can always go to Amazon and find our book, Body Mapping Acupuncture, in the spirit of Master Tung, because I always like to give a little reference to our ancestors who have come before us. We are literally standing on the shoulders of all the generations of, I didn't make up acupuncture. So we learned it from somewhere, right? We add our little piece, we change it to our own clinical specifications, but we all come from somewhere else. We have ancestors, and it's nice to respect that. So I like to respect the Master Tung and the Tung family lineage of acupuncture. The charts aren't available on Amazon, but you can find them from our website, or eLotus sells also the book and the chart. You can order from them directly. eLotus or Evergreen Herbs, eLotus.com, evergreenherbs.com, I think. And then Body Mapping Acupuncture. And then our website is acupuncture-gateway.com, or acupuncture-portland.com. We also have a Facebook forum. So you can go to Cole's Body Mapping Acupuncture Forum, and we have, like yourself, acupuncturists from all over the world, since I have been teaching internationally, Australia, and then I taught in Switzerland a couple of times, and I have students from we've taught in Sweden, a number of countries. So we have acupuncturists from everywhere, and the word of mouth gets out. People find my book, they watch me on eLotus, and they come to the forum, and so people put in questions, and we answer them, and some senior students will answer some questions for people, and I'll chime in if I think it's appropriate when I have a minute. But we've got over 2,000 people on the forum now, so it's really expanding quickly, which is wonderful, because it's just so many more people that we can assist and help. So yeah.
Okay, brilliant. Well, it's been a joy talking to you. Thank you very much. And I always learn a lot when I meet you. So thank you again.
Wonderful. Well, I'm happy to share and talk with you anytime you want. So let me know.
Excellent. So I'll just pause the recording or stop it.